Hi everyone. So today I'm going to be talking about drugs to treat drug abuse. This will be a look at different medications that are approved and currently being used to treat various drug use disorders. So just a quick overview of the content. We'll have some brief terminology. Then we'll take a look at medications that are approved to treat alcohol use disorder, then opioid use disorder, then smoking cessation or nicotine use disorder. We'll also look at a couple of different drugs that do not have any approved medications for treatment, and then two links that I think will be very interesting for further reading and could be beneficial for you. Just some brief terminology. You may already be familiar with this, but just in case you're not, commonly used term in the field these days is medication-assisted treatment, or MAT, and that's just the use of medications to support the recovery process. It's often used in conjunction with other types of treatment like cognitive behavioral therapy or self-help groups. The term craving, which is used on several slides, basically an overwhelming urge to use a drug or engage in a behavior. Note that in the DSM-5, craving is one of the criteria to diagnose substance use disorder. And then co-occurring disorders indicates the presence of both a substance use disorder and at least one other mental illness, such as depression, anxiety, or schizophrenia. All right, let's look first at medications for alcohol use disorder. So there are several in this category. So the old traditional one was antabuse or disulfiram. There's actually mixed results on whether that's beneficial or not. If somebody's taking antabuse and they drink alcohol, it's going to cause them to become violently sick, maybe even need to be hospitalized. It doesn't do anything to help cravings, but it can discourage somebody from drinking. Again, the evidence on that is mixed, so it's not as strong as some of the other ones. Naltrexone, which you'll see is also used for opioid use disorder, does also help reduce cravings to drink. It's available orally, but also as an injection now. So that's one that's showing pretty good evidence for success in alcohol use disorder. Another one that's been successful is a camprosate or Camprol. And the evidence in that is that people may still drink, but they may reduce the amount that they drink and increase the number of days that they're abstinent. It is best to start that if somebody's not currently using, but again, the evidence is pretty strong for that one. Topiramate or Topamax may help clients reduce alcohol intake. There's been a few studies on that, but again, those are somewhat inconclusive. The evidence isn't strong. In a couple of the studies, placebo groups had the same recovery rates and abstinence rates, but that is still one they're investigating in not only for alcohol use disorder, but also you'll see for cocaine use disorder that may potentially have some benefits. Antidepressants may also be used, and that would not just be for somebody with alcohol use disorder, but if somebody also had a mental illness like depression or bipolar disorder, those antidepressants may help with the mental illness, and that may also help them reduce their drinking. And then finally, benzodiazepines, those aren't technically a treatment for alcohol use disorder, but they are used for medically monitored withdrawal to help with that process. Okay, looking at opioid use disorder. So methadone is a synthetic opioid we've had for about 50 years now that we've been using it. It gained a lot of popularity in the 1970s when veterans from Vietnam were coming home, and many of them were addicted to heroin and needed some kind of help to get off. So what that does, methadone, is that it prevents withdrawal. It has a longer half-life than most other opioids, so it stays in your system longer. So you can just take one dose a day. And another huge advantage is that unlike most other opioids, where you have to continue taking more and more and more and your tolerance increases, for most people, their tolerance levels off on methadone and they can find an amount that they're able to stay stable on over a period of time. Now, a newer substitute drug, buprenorphine or Suboxone, is both an opioid agonist and antagonist, which is interesting. So it is mildly reinforcing, meaning it does cause some pleasurable effects, but at the same time, it's blocking all other opioids from getting through. So it binds very strongly to the opioid receptors so that if you were using another opioid, that would not have any effect. So it would discourage you from using. It is approved for anyone 16 and over. So if somebody is young adult or adolescent who has an opioid addiction, it's potential that they could be prescribed and use that drug. Naltrexone is another one that's been quite effective at reducing relapse for people. It does block opioid receptors and it's longer acting. They now have a monthly injectable form of that called Vivitrol, and that can last for about 4 weeks at a time. So that's been fairly effective. And as you remember, it also is being used for alcohol use disorder. As a best practice statement, MAT or medication-assisted treatment is considered the gold standard of treatment for opioid use disorder. So that is considered our best practice in the field. Now you'll note at the bottom that naloxone or Narcan is an opioid agonist. It's used to reverse opioid overdose. It's basically emergency medicine. It's not really a treatment, but it is good to be aware that that exists. Okay, looking at nicotine or smoking cessation. So there are several nicotine replacement therapies on the market. These can be fairly easily purchased by anybody. Nicotine gum, patches, lozenges. Those are all containing nicotine and basically replace the cigarette or other chewing tobacco, whatever it is. Then there's an antidepressant medication called bupropion, which was originally Wellbutrin. And if you take it as an antidepressant, it's still called Wellbutrin. But because of the stigma around antidepressant medications, they repackaged it as Chantix, but it's the exact same medication. And they found kind of accidentally through trial studies that it was reducing people's cravings for nicotine. So that's another option for people. There are a couple of drugs that have no treatments approved so far. One of those is cannabis or marijuana. So they have looked at a few different things that may help with some of the withdrawal symptoms, but nothing is approved on the market right now. Sleep aids have been investigated as one way of assisting the withdrawal process because sleep disruptions are one of the major withdrawal symptoms of cannabis use disorder. And then for cocaine, they've looked at probably a dozen different things with no clear outcomes yet to show anything being particularly effective. They're looking at ways to perhaps block cravings or block the euphoria one might experience when they're using. They're looking at dopamine agonists, things that would kind of trigger dopamine for somebody as being useful to help avoid cocaine use. But at this point, nothing approved so far. So the last slide here, there's two different things I would recommend for further reading. So the first one up there, tip 43, that's from SAMHSA, the Substance Abuse and Mental Health Services Administration. They have dozens of free guides. I strongly recommend going to their website. If you click on the link there for tip 43, it'll take you directly to the PDF and you can look through that. It's a short 360 pages or so, but there's a ton of amazing information in there, so you can go through it at some point or at least look at some of the information when you get a chance. And then below that is the article Medications for Alcohol Use Disorder. That is just an 8 or 9 page article, and they did a wonderful job. They give you the DSM criteria in there. They give you the major drugs that have been used to treat alcohol use disorder, as well as what studies have been done on that and what has been the success. So I definitely recommend reading through that when you get a chance. All right, that wraps up this presentation, so thank you.